media live. कोणी विचारत
If you refer their website, you can see what all campaign did. human right. So if you are feeling sick, you are supposed to see the that you take proper treatment, you go access treatment and treatment. But this year the health and maternal and child health problems are rising up. So they changed the theme into what? It is been displayed for you earlier. Okay, so which is focusing on more on maternal and child health. So the hopeful future and the healthy beginnings. This is what the present theme focuses on. So our students of this semester will be now demonstrating to you like what is the theme, about the theme and all. We will be coming to know what their presentation. They will be doing a mic also in order to make us get aware about this thing. So next year when you know, you will be recording this year's theme also, right? Okay, so the focus will change every once the focus was depression because they felt that depression was the second leading cause of death. Okay, we all studied health definition. Who's responsible for the definition? Okay. Okay, now so that definition we would have it. So when we provide the definition, I know everybody are aware about health definition. So but are we mentally, physically and the other aspects are we healthy? No, most of the time. So today even I'm not physically healthy, but I'm definitely mentally healthy. So in all aspects you have to be healthy. All you are as healthy person. I wish you all a very happy World Health Day. Thank you.
Thank you so much, ma'am. Before we begin the program, I request all the dignitaries to occupy the front row. Today, we are going to explore a PowerPoint presentation on the topic Healthy Beginning, Hopeful Futures. So, let's give a warm welcome to Merlin.
Good morning, everyone. As you all know, today is World Health Day, and it's not just World Health Day, but it is a way of spreading awareness among people why health is very important and why you should be healthy, and also what are the ways you can adapt. So, World Health Day is celebrated every April 7 to promote health awareness, and also it is organized by the World Health Organization each year with a specific focus. So let's see what's the focus this year. So this year the motto is Healthy Beginning, Hopeful Future. Healthy beginning could be any time. So if a person who is obese or if a person who is addicted to alcohol can start a new life. But this word has other meaning. Healthy beginning is very important, but this time we are mainly focusing on pregnant or antenatal mother and a child, because life of human being starts when a baby is in the womb, and many things can happen. Even a minute or tiny changes or any accident can lead to many complications and diseases. So it's very important for mother to take care of a child and also the people around her in a family or community, instead of spreading misconception, spreading positive energy and giving good health education to the mother. So the significance is, first is it marks the foundation of World Health Organization. So World Health Organization, this was founded on this day in 1948. Next, it raises awareness about global health issues. As we all know, days goes by, years goes by, diseases have increased due to lifestyle changes, the air we breathe, the food we take, and also the water we drink. Everything changes. If the water is not clean, we'll get many diseases, typhoid or any other. And also, especially in case of mother, if she doesn't get any good nutrition or good food, even the people around her are not giving her the positive energy. They're saying telling bad things. no, you should do like this, you should do that. It's bad for a mother, right? So it's very important for us to spread, good, to spread awareness about the health. Next is encouraging healthy living and good habits. So how can we encourage a person, not only just a mother, even other people? So we can tell a person to, wake up early in the morning, go for a walk, or if not walk, to sit and just meditate for a minute, eat healthy, balanced diet, drink water at least 2 liters a day, and get good sleep. Sleep is also very important to preserve our mental health. Next is highlight different health theme each year. Like this year it's about healthy beginning, promotes good future. Next, reminds us that health is a human right for all and not a privilege. We all know if we want to take care of about our own health, we should think about it. We should adapt a new lifestyle. We should consume good food. We should also preserve our mental health and also get good rest. Next, it promotes access to healthcare for everyone and everywhere. Especially in India, rural areas, they are not, they don't get the supplies, they don't get the facilities to go to the health center. Maybe because of financial reason, or maybe it's somewhere in the remote area where they cannot go to the health center. So if a woman wants to, if she's in a labor and if she wants to give delivery, obviously they'll give. But what about the aftercare? Mother could be prone to get infection. If the dressing, if the cleaning is not done properly, she might get infection. And also baby, a baby will be very at a risk of getting infection. It's very important for a mother as well as a child to be treated and given immediate care. Next is unites people worldwide to take action for a better health. It's not only duty of our healthcare workers but also the people around to tell others to spread awareness about adapting a good lifestyle to promote health. So based on our theme this year, so what is the role of a maternal and a child health? Healthy mother ensures healthy habits, healthy babies, laying the foundation for a strong future. Like I said, mother is not healthy. If she is depressed or if she is having any kind of communicable disease, it could also affect the child, right? Not only the mother, even her husband, if he is not treating her well, if he is like, alcohol addicted person, if he is hitting the mother, it could change, right? It will hurt the mother. Or any kind of complications during pregnancy can have a bad outcome. Next is maternal and infant health affects cognitive development and immunity and longevity. So if a mother's mood is not good, if she is always depressed, if the people around her are always telling, no, you will not give birth to a girl child, no, you have to give birth to a boy child, it's not good for a mother. First of all, she is having a lot of mood swings, and upon that, if her mood is not good, she might take another step, or she might go for an abortion, which is not good. Or think if there is domestic violence in the family, it affects the child as well as the mother. Investing in maternal healthcare reduces child mortality and improves life expectancy. So if a mother is having anemia, or if the mother is having low hemoglobin level, she can go to the primary health center to take some supplements, or she can go to any health center to check if she is having any other complication or if she is having diabetes. It could prevent certain complications, or after delivery, even the child may not have any problems if she is taking good care of herself. I have two questions here. First, it says why healthy beginning matters, and the first 1,000 days a crucial period. So healthy beginning could be any, but today we are focusing more on antenatal mother, or even before. If a mother is planning to start a family, or if a family is starting to if her husband and her wife is planning to start a family, why is it important for them to think properly and take care of it? For example, think the mother is having any communicable disease, and she is thinking, okay, fine, nothing will happen to the child. Obviously, think if a mother is having HIV and she is pregnant, even the child will be affected, right? Some of the other day, she will, it will lead to AIDS and child will die soon. It's not good for a baby. So it is very important for a mother to take care of herself and also understand the importance of the beginning. If she's taking good food, a nutritious diet, doing a little bit of exercise, many complications can be prevented. Another thing is first 1,000 days a crucial period. When the child is born, child will be growing rapidly. 6 months of exclusive breastfeeding should be given. After that, weaning should be started. Some mothers don't know about it, so they'll be like, no, it's okay, I think there's no problem, and they'll start weaning later, which is not good. So it is very important for us as a healthcare worker to provide health education to the mother, antenatal mother as well as postnatal mother about the nutritious diet, the healthy lifestyle, like sleeping, rest, and meditating. Another thing is about the immunization. Certain mothers have misconception that it is not good for the child and they don't take it. They'll be like, no, it might affect the child, she's having allergy, and they'll tell all kinds of stupid things. So it is very important, it's a duty of our healthcare workers to spread the awareness and the need of taking immunization and vaccine and certain supplements for the child for the better growth and health. Maternal health, prenatal and postnatal care. Regular checkup, screening and supplements, iron, folic acid prevent complication. So iron and folic acid is needed in case of anemia, if the mother is having low hemoglobin level. Blood is needed, right, when a mother is pregnant. So it's also important if a mother goes to the healthcare centers to do regular checkup, like ultrasound or checks her diabetes if she is having gestational diabetes. It is very important for a mother to do certain checkup. And if she is not able to do, there are ASHA workers who go to the house to check if the mother is doing okay or not. Next, the same childbirth practices lower maternal and infant mortality rate. There are certain hospitals which are not well developed, so they will not practice aseptic techniques. So when the delivery is done, mother and the child is at the risk of infection. So it is very important that during the delivery, aseptic techniques, sterile techniques should be followed to prevent complication. Postnatal care helps in recovery and provides support for breastfeeding and mental health. Like I said, exclusive breastfeeding is very important. After that, weaning should be done. If a mother don't know about it, doesn't know about it, it's our duty to tell, and also the educated person who knows about it to tell the mother that she should give good nutritious diet to the baby, and also not only to the child, she also has to take good nutritious diet and get enough adequate rest. Ensure a safe childbirth. Skilled healthcare professional reduce birth-related complications. Like I said, if aseptic techniques are not practiced during the delivery, it can lead to certain complications, pneumonia, or the child will die within a month. Access to medical facilities and emergency care services like certain rural areas, they don't have health centers. So nowadays they have started ambulance in the remote areas so that if anyone has any problem, they can take them immediately to the hospital. So I think it is very important for every mother and also the person who is not doing well should have the access to emergency care or any ambulance, so that if they are at the risk, they can be taken immediately to the hospital. Education on hygiene, nutrition and self-care helps mother recover post-birth. Not only antenatal period is important. After the delivery is over, like I said, if a mother doesn't take good care of her genital area or other areas, child will face the problem. So if mother doesn't follow hygienic habits, like if she's not cleaning the clothes properly, she's wearing the same clothes again and again, food is not cleaned properly, child will get disease, right? And since she is breastfeeding, and if she is not sick and she is not clean at all, then the child will get the problem. They are keeping it on the mother's chest and giving her skin to skin care. You all know what it is? Skin to skin care. What is it? That should be given. Then colostrum, the first milk is packed with antibodies that protects newborn. Exclusive breastfeeding for 6 months reduces infant mortality rate and strengthens immunity. Those antibodies are very important for a child to stay healthy and also prevent, what do you say? The child is not having much of immunity. So when she is taking that, when she is getting that immunity from the milk. So it is very important for a mother to give breastfeeding to the child. Next, mental well-being. Postpartum depression and anxiety affects many new mothers. It is very common for a mother to have mood swings like depression. If her husband is not looking after her, if he is ignoring her, there are certain couples who want to be, always, together. If her husband is not there, even she feels sad. Or if the, family is not supporting her, if she is just left like that, she will feel depressed, right? So it is not only, responsibility of a mother. Even the family members are responsible to, support her, to encourage her, to make her feel happy. Another is early mental health supports improving parenting and child well-being. So, as a healthcare workers, we have to give health education to the mother and as well as the family that these changes, whatever is happening, like the mother feels down, if she feels sad, it is normal. But we have to tell that not encourage her, make her happy, support her. Encouraging open conversation and counseling reduces stigma. Stigma is misconception. Like there's something that mother can't go out at all, like for 2-3 months, she'll get infection. So such things should be